Natural and home remedies for schizoid personality disorder. It is difficult to accurately assess the prevalence of this disorder, because people with schizoid personality disorder rarely seek treatment. Schizoid personality disorder affects men more often than women, and is more common in people who have close relatives with schizophrenia. Schizoid personality disorder usually begins in late adolescence or early adulthood. Causes schizoid personality disorder. Little is known about the cause of schizoid personality disorder, but both genetics and environment are suspected to play a role. Some mental health professionals speculate that a bleak childhood where warmth and emotion were absent contributes to the development of the disorder. The higher risk for schizoid personality disorder in families of schizophrenics suggests that a genetic susceptibility for the disorder might be inherited. Symptoms. The symptoms of schizotypal personality disorder. Different ideas of identity. Unrealistic goals and aspirations. Lack of empathy. Unnecessary anxiety in relationships. Needless mistrust in relationships. Odd behavior. Unusual thought process. Unusual sensory perceptions. Bizarre experiences. Cold and indifferent to emotional stimulus. Prefer to be left alone. Suspicious personality traits. Feels persecuted by others a lot. Doubts loyalty of those who are close. Paranoid behavior. Lack of friends. Poor relationship skills. Treatment. Talk therapy, psychotherapy. If you feel that you would like to have closer relationships, a modified form of cognitive behavioral therapy may help you change the beliefs and behaviors that are problems for you. A therapist with experience treating schizoid personality disorder is likely to understand your need for personal space and how difficult it is for you to open up about your inner life. He or she can continue reaching out to you without pushing too hard. A form of counseling is the form of treatment most often used. Treatment likely will focus on increasing general coping skills, as well as on improving social interaction, communication, and self-esteem. Because trust is an important component of therapy, treatment can be challenging for the therapist, because people with schizoid personality disorder have difficulty forming relationships with others. Medications. Although there's no specific drug to treat schizoid personality disorder, certain drugs can help with symptoms. Or while antipsychotics are not a routine part of treatment, they may be used to help with flattened emotions and social problems. Medication is generally not used to treat schizoid personality disorder itself. Drugs might, however, be prescribed if the person also suffers from an associated psychological problem, such as depression. Group therapy. A goal of individual treatment may be a group setting in which you can interact with others who are also practicing new interpersonal skills. In time, group therapy may also provide a support structure and increase your social motivation. Here are some home remedies for schizophrenia. Panax ginseng. Panax ginseng is considered good for improving memory, thinking and concentration. Ginkgo biloba. Ginkgo biloba is being studied by the scientific communities as an adjunctive treatment for schizophrenia, as it may help enhance the effectiveness of antipsychotics. It is also believed to protect against neural damage caused by antipsychotics. Fish oil. People suffering from schizophrenia tend to have low levels of omega-3 fatty acids in their blood, as it is associated with a depletion of certain fatty acids. Thus, fish oil supplements high in EPA, icosapentaenoic acid, can help reduce the symptoms of schizophrenia. Brahmi. Brahmi, also called bacopa, is popularly used in Ayurvedic medicine to enhance cognitive ability. Animal studies indicate that it can also help improve schizophrenia. Although the exact mechanism as to how it works is not known, it is believed to help stabilize certain chemicals in the brain. It also exhibits neuroprotective properties. Antioxidants. Antioxidant vitamins like vitamins A, C and D are considered helpful in reducing the severity of schizophrenia. Vitamin C is also an anti-stress vitamin. Research indicates that there could be a possible role for oxidative stress in the development of this brain disorder. Antioxidants help neutralize free radicals and reduce oxidative stress. Exercise. Regular exercise is good for maintaining physical as well as mental well-being for schizophrenics. It helps improve your mood and alleviate anxiety and depression. Engage in 30 minutes of moderate physical activity every day. You can try walking, jogging or strength training exercise. Yoga, too, is considered helpful as an add-on therapy for schizophrenia as it can help reduce psychotic symptoms, produce neurobiological changes and improve cognition and the quality of life. Ashwagandha. Ashwagandha is another calming herb useful for depression, anxiety, and other psychiatric disorders due to its anxiolytic and antidepressant effect. This herb can offer blood glucose and cholesterol-lowering effects to combat the side effects of antipsychotics associated with higher incidence of metabolic syndrome. Chamomile. Chamomile has soothing and calming properties. It also promotes restful sleep and thus is useful for those suffering from schizophrenia. Add 1 teaspoon of dried chamomile flowers to 1 cup of hot water. Cover and allow it to steep for 5 minutes. Strain the solution. Drink it daily in the evening. Basil. Basil leaves have excellent antioxidant properties and also promote brain functionality to improve the symptoms of schizophrenia. Steep a few basil leaves in hot water for about 5 minutes. Strain and sweeten with honey. Drink this tea twice daily. Green cardamom. The seeds of green cardamom can also be used to help deal with schizophrenia as they are good for the nervous system. Steep 1 teaspoon of powdered cardamom seeds in 1 cup of hot water for 5 to 10 minutes. Strain it and sweeten with some sugar or honey. Drink this tea twice a day. Tips. Do not skip your medications. Stay away from drugs and smoking as they may worsen the symptoms of schizophrenia and make the treatment less effective. Schizophrenic patients and their family members can join self-help and support groups.